పర్లేదు. ఏమొస్తుంది? కాదు మేడం. లోపల కాదు, నెట్టే. అది మీదే. రాదు. ఇప్పుడు మీకు ఏ వైఫై ఏ చూపిస్తుంది చెప్పించు. మరి సార్ హలో హలో సార్ 10 minutes సార్ వెళ్తాను, కొంచెం జూమ్ ఆన్ చేస్తాను. సరే సార్ వెళ్తాను. మేడం ఎవరో జాయిన్ అయ్యారు నేనేనా మేడం? మేడం ఇతనేనా పోస్ట్?
మేడం ఫెయిల్ అయిపోయిన ఒక్కరు కూడా రావట్లేదు మేడం.
The main aim of this program to explore the evolving landscape of digital healthcare. So, as we all know that today, healthcare is no longer confined to hospitals. It is powered by innovation, technology, and connectivity. So, from telehealth to AI-driven diagnostics, we are stepping into a future where digital health is transforming patient care and medical education. So, to begin this program, I would like to invite students to sing a song, prayer song. Let us all invoke that invoking the God's presence. Thank you. I think that's the same. Okay, that's it. So thank you for invoking us, God's blessings. To have a formal welcome, I here stand on behalf of Narayana College of Nursing to deliver the welcome address. It's my proud and privilege to invite our respected principal, Dr. B. Manish Kumar, Ma'am, Principal, Narayana College of Nursing. So we welcome you, Ma'am, Faculty Development Program. So, ma'am, your leadership and vision continue to inspire us. Formally. Thank you, ma'am. I also take a privilege to welcome all the HODs, associate professors, assistant professors, tutors, and all the participants, those who are going to attend online and offline. So, to welcome you all on behalf of Narayana College of Nursing. And first and foremost, I would like to welcome today's speaker, Professor Usha Ma, to the Faculty Development Program. Ma. We welcome you, Ma. Inaugural speech. Before that, let us have the lamp lighting ceremony. So I request all the dignitaries, please kindly come forward for the lamp lighting ceremony.
బయటకు వస్తుందా సౌండ్?
Usha ma'am, good afternoon.
Madam, good afternoon, madam. Good afternoon. Thank you.
How are you, ma'am?
Fine, fine, madam. How are you, madam? Thank you. Thank you so much. How are you, madam? You have organized very well program.
Yeah, ma'am, thank you. Another one more thing also, thanks to you, ma'am. This busy schedule,
Tha-
that's why you are accepted our invitation, ma'am.
Thank you, madam. Thank you so much for giving up this opportunity. And also, it is a very good program for our faculty development. You have organized it very well. Thank you, madam, for giving me this opportunity for you. And Pratima is also continuously, she is following me, follow up to present this. Thank you, madam. Thank you so much.
Thank you so much, ma'am, for what is the digital health advice and applications and new things. Our nursing profession is going to be advancement, ma'am, advanced technology. In that, we have to expect a new side that whatever. Today we are going to be inaugurated first session yours only, ma'am. Once again, thank you so much, ma'am.
Thank you, madam. Thank you so much.
Thank you, ma'am, for being welcome. So before begin, let me invite the today's speaker. So ma'am is assistant professor, Dari Usha Pallagileni ma'am, Government College of Nursing, Srikakulam. So ma'am is highly experienced and brings with a wealth of knowledge in digital health and nursing education. So before begin the ma'am session, let me introduce the ma'am. So ma'am has completed MSc in Medical Surgical Nursing, MBA in Hospital Administration. So ma'am worked as a 16 medical nurse in charge in ICCU and cath lab. Madam had 16 years of experience in different cadres, and madam was promoted from lecturer to the assistant professor. And currently, madam is HOD and coordinator for the first sem, second sem, and third sem, and all the fourth sem students. So, ma'am is a paper setter for the different universities, and ma'am has completed BCLS course, and madam is experienced person to provide the BCLS certificate course. And ma'am worked as a clinical instructor for advanced trauma life support. And ma'am also has completed the training in national emergency life support. The ma'am is also a national research station TOT. Worked as an executive chairperson for nursing education of TNA in AP branch for 6 years. And currently ma'am has received the president of TNA in AP. So we welcome you, ma'am, for taking up the session on health and virtual education balance. How to use this in to welcome you, ma'am, and over to you, ma'am.
Thank you, Pratima. Thank you.
Ma'am, shall we share the PPT from our side?
Please, Pratima, please. Good morning, all the respected dignitaries and all the participants. Very good evening, one and all. So today we are participating in very good program. In the present scenario, we all need to learn about this digital health services and how we have to utilize this technology, how we can implement to our students while teaching, while in your practice. So this is a very good program and essential program also, which is organized by the prestigious college, the Narayana College of Nursing, which is organized by Dr. Vanjakumari Madam, and the program planned by Miss Pratima. Thank you so much, one and all. So the digital health services and its appliances is very, very essential in the present scenario for all of us. So in the present era, the artificial intelligence is came into the existence. So we have to learn what is a link, what is a digital health, how it is incorporate with our health services, how we can implement the healthcare services near to the patient by the help with the digital media. So for that, we have to see today our presentation on by the how we can applicable by video conference and telehealth services, how we have to be applied. So further, we will see today. Today our presentation is by the telehealth and virtual presentation, which is applicable to our patients, how we can provide care through the telehealth services. It should be very reachable to the patients who are unable to reach the hospitals, we are unable to get the service within the time. So this telehealth is very, very helpful and reachable to each and every personnel who is a needy people. So for that, we will see the session today, how we will apply the telehealth services in the, to the needy people. The telehealth is reshaping how care is taught, delivered, documented, and evaluated. How we can apply this telehealth to the care who is a needy people, we should learn. For nursing education in India, it offers a practical bridge between classroom learning, bedside care, and community-based digital service models. This presentation explores why virtual care matters now, what is changing in Indian healthcare, and how nursing faculty can prepare learners to participate confidently and ethically in this transformation. So when we learn about this telehealth, we can as early as possible, it should be reachable to the client who is in need about the health care. So without the, in the cost saving also, which will be benefit, and as early as possible, initiation of the treatment to the patient is very, very beneficial, and also which is a very convenient. So how it can be utilized by the needy people or patient or the family members. So we have to learn through this. We can teach the students and also we can apply in our clinical era. Ratma, move to the next slide. So why this telehealth matters now? The Indian healthcare system is balancing a large population, uneven distribution of the specific access gaps, and rising chronic disease burden. Telehealth and virtual care help extending hospital walls by using video, phones, messaging, remote monitoring, and digital trials. This is not only the technological shift, it is a service redesign that supports continuity, access, efficiency, and patient-centered care. When a person was discharged from the hospital, so when we are followed by the telehealth each and every time, the people unable to reach the hospital, unable to meet the doctor physically. So when this telehealth services, which is very, very useful for the rehabilitation, for the continuation of the treatment, for the clarification of the doubts, this telehealth will be very, very well, very helpful. In how far which will be utilized, which will be accessible is first one is a improved access. So the access will be improved very nice. Why? Because the people will be live where there is in a tribal area or remote areas or underserved regions. There is no connection of the transport and all can connect with the clinician without long travel or waiting times. Without there is no waiting time. There is no need to long travel to reach the doctor. See, this telehealth will be very, very beneficial. The second one is a continuity of the care. There is if without knowledge, if they want to stop the treatment, they can able to access to clarify with a doctor whether that the treatment can be continue, how far they have to continue, or they can taper the medicine, or they can the stop. So for all these doubts, they can clarify by with the help of the telehealth matters, by the follow-up, medication review, and chronic disease monitoring and the counseling become easier after discharge. Even after discharge, the patient and the family members may have many doubts. If there is even minute change, even though they may have little scared, so immediately if they need any clarification, they can get the doctors can be connected by the telehealth, they can clarify their doubts and they can get the counseling by the doctors and healthcare team through these telehealth services. The third one is a cost and time saving. The families save travel expenses, work time, and avoid unnecessary visits when appropriate care can be delivered virtually. So they can be save the money, they can be save the time, and also unnecessary hospitalization also can be protected by the clients. If the person was reached to the hospitals, so they may have the access and they can be prone, they can be exposed to the some infected area. So from that also they can save by this telehealth services. And the next one is the system resilience. So virtual care strengthens service delivery during outbreaks, weather disruption, mobility limitations, and workforce shortages. Even though if there is no workmanship or there is no, the weather may be not comfortable, so they can able to get the knowledge, they can be able to get the advice by the doctors through these telehealth services. The last one is a patient convenience. It is a more important. The care is increasingly expected to fit into daily life, not required repeated hospital visits for every concern. If they may have any doubts, if for any clarification, there is no need to go to the hospital. They can able to clarify by these telehealth services. The telehealth is one of the biggest shifts. The digital health is a broad umbrella that includes telehealth, mobile apps, artificial intelligence, wearable devices, and data driven tools that support care before, during, and after a visit. So, by this digital health and the digital applications, by the telehealth or mobile apps, by the artificial intelligence is playing a pivotal role, whereas in the healthcare industry, in the point of diagnosis and all, so which will be helpful for the patient during the care or during the treatment or during the doctor's visits. The telehealth works alongside artificial intelligence and big data and mobile technologies to improve access, coordination, and the decision making, which will be very helpful for the needy people. So the clinic care delivery. The telemedicine, what is that? Telemedicine is whenever a doctor consults a patient online, that is telemedicine. There is no need to the physical contact. There is no need to the physical visit. So that is the telemedicine. Telemedicine focuses specifically on clinical services, includes remote consultation, diagnosis, follow-up, and treatment when provider and patient are not in the same place. So the doctor can be guide online to the services to the people who are required the doctor's advice or care. So how the telemedicine has evolved. So which will become the existence first. They are from by the radio. They may have so many advices they can be give by the related with the healthcare. So the radio is a early wireless consultation. The next one is a telephone, voice-based remote care. So the next one is a video visits, the real-time visual examination. By the video visits, they can able to examine, they can able to identify the symptoms, they can able to identify the situation of the client, they can advise. And lastly, now we are in the artificial intelligence era. So by the artificial intelligence, diagnosis is the algorithm driven clinical support. So the exact diagnosis is possible by the artificial intelligence. So the technology uses, it is a backbone of the telehealth. First one is a video platform. It is enables real-time consultation and follow-up and wearable support, ongoing monitoring of vital signs and activity. And artificial intelligence adds decision support, triage, and pattern recognition. So, based upon the symptoms, based upon the patient condition and the biographic data, it can be support how far they have to take the decision to go to the hospitalization, what type of medication they have to utilize in time. So these all are they can able to get the advice by this telehealth as early as possible by the initiated this. Technology is the backbone of the telehealth, helping clinicians extend care beyond the clinical walls. So beyond the walls, the doctors, they can provide the care to the people where there is a need with the help of this technology. So the different models from different needs. The first one is a synchronous. Synchronous care means live interaction between patient and provider. To the telemarketing, to the telehealth, they can be direct live interactions. In the live interaction, they can able to show the pain, where there is a pain, where there is a swelling. So like that, they can have the live interaction in between the patient and the care provider. The second one is a asynchronous. Asynchronous care needs information for review later. This information, if they have any doubts after 1 month or 1 year, so if they have recurrent of the complaints or recurrent of their services, it will be helpful for the review. The last one is a remote patient monitoring. It is enables continuous tracking over time. So continuously how the disease is progressing, or which will be under the control, or which will be to the preventable or curable or treatable. So like that they can able to monitor continuously. They can able to track the patient over the time. Each model serves different clinical needs from immediate conversation to long-term monitoring. The government initiatives, the policy is accelerating adoption. Adoption is a e-Sanjeevani provides a free online consultation to expand access at scale. And ABDM is building a national digital health ecosystem for interoperability and records. The government support is a major driver of telehealth adoption in India and creating the infrastructure and the trust needed for broader use. So this telehealth is a very, very essential. The government is also taking initiation. So actually, whereas I was experiencing in when I was in a clinical service, when there is in a corporate sector, I was experienced with one client. If they may have a doubt, so they are doing a one complicated surgery, the Whipple surgery. I may know all the nursing faculty, you know about the Whipple surgery, which is a little bit complicated surgery. By the video call, they have to be taking the guidance from the US. They were successfully did the surgery of the Whipples. So the patient can be survival. So like that, this video calling and the telehealth is, there is an emergency situation also, which will be very, very helpful. The government little more initiation to have this telehealth to reach the care to the remote areas where there is a needy people. So the what virtual care includes? The virtual care includes is which is broader than the video consultation. It includes multiple modes of service delivery that can be matched to the clinical needs, patient preference, and local resources. Nursing faculty can teach the students to recognize which mode is appropriate, what can be handled asynchronously, and when escalation to in-person care is necessary. The teaching faculty can be guide to the students in which area and which option they can be choose to provide a care. First one is the video visits. The real-time consultation supports assessment, teaching, counseling, medication review, and follow-up when visual cues are important. Where there is no video visits, they can assess, they can teaching, they can and the counseling, and how far they can continue the medications. These all are they can able to get. The asynchronous messaging is which secure text, image. So these all are be helpful for the review later after many days, after many months, which this information will be very helpful uh, for the record person, the review of that particular client care. And secure text, image, or form-based communication useful for routine follow-up, symptom checks, and wound review and care coordination. So to learn if there is any recurrent of the complaint, when they were go through the review of the records, which will be very helpful for the persons who are providing the care. And remote monitoring. This is a vital and condition trends can be tracked over time for chronic illness management, early warning and discharge follow-up. And who are suffering with the cancerous disease or who are suffering with the geriatric problems. So these all are, they can be managed with the help of by the remote monitoring. And the next one is virtual education and coaching. The nurses can teach self-care, family education, rehabilitation exercises, and medication adherence through structured digital sessions. So the nurses who are working under the cardiology department or who are working under the post thoracic and who are working in the oncology departments, which is a chronic illness, they need more rehabilitative services who are undergone the orthopedic surgeries. So they need more rehabilitative services and self-care education and counseling. So this can be, the nurses can be teach with the help of this telehealth by the virtual mode. They can give more care to the persons. They can utilize the digital sessions. So India opportunity, equity, reach, and efficiency. The strongest argument for telehealth in India is equity. Virtual care can reduce geographic barrier and enable more timely access to expertise where specialists are concentrated in urban centers. It also supports task sharing where trained nurses and frontline workers help with screening, education, follow-up, and escalation under clear protocols, which will be very, very helpful if all the specialists can be work in the urban areas, even the remote area people also can able to get the services by this expertise people with the help of this virtual core and telemedicine. So this is very useful for the people. Each and every remote area corner people also where there is a needy people, they can get the care by the senior faculty and senior consultants. The access gains. The patient can consult from home, school, or workplace or local health centers, reducing missed appointments and unnecessary travel. This matters especially for elderly adults, pregnant women, people with disability, and patients with a chronic disease who are unable to travel, as like a pregnant woman and a disability and old age people, they can get the access to get the care. And virtual services can also improve reach in public health program, postnatal follow-up, medication adherence support, and non-emergency triage. The persons may have many doubts in that they can contact by the telehealth if there is any risk. If there is any immediate need to attend, there may be any triage. Immediately they can able to get the care by this telehealth services. The system gains hospitals can reduce congestion by shifting suitable cases to virtual follow-up. Staff time is used more strategically and documentation. Scheduling and patient instruction can be standardized for better quality. In nursing practices, this creates new role in digital triage care, coordination, patient navigation, and remote coaching. So that the nurses can have a great opportunity to provide care to the many people with a easy access, and in time we can provide the care when we follow these digital health services. The role for the nursing faculty and the nursing practice. The nursing faculty are centered to making telehealth credible, safe, teachable. The students need to more than technical familiarity. They need communication skills, clinical judgment, and a professional ethics and the confidence to work with digital tools while preserving compassion. So when the nurses are the faculty, then they can able to teach the students to utilize these digital health services to provide the care. Teaching digital communication, students should learn how to begin a virtual encounter, confirm identity, maintain rapport, and use clear language when visual and non-verbal cues are limited. So when we are teaching how they have to maintain the communication, how they have to maintain the continuity of care, we when teach, they have to be follow that. And supporting triage and escalation. Faculty can train learners to identify red flags, determine when virtual care is appropriate, and escalate quickly when a patient needs in-person assessment or emergency referral. So when we are teaching them in the digital services, so we are teaching them to the people where there is a needy people, we can provide the care. So when a patient need in-person assessment or emergency referral, so what they are learning, the triage system they can be implement, which is essential, which is emergency. They have to be judge the person to take a care. Embedding clinical documentation. Virtual care must be documented accurately, including mode of contact, consent, assessment findings, advice given, follow plan, and safety net instructions. So the documentation is very, very essential. While in the digital mode, each and everything will be recordable, which will be very helpful as a documentation. Modeling professionalism. Faculty can reinforce privacy, respectful online conduct, appropriate boundaries, and culturally sensitive communication across every digital interaction. So they can be enhance their knowledge, they can maintain their privacy, and they can be respectful online conduct providing the services. So the from classroom to clinic, a teaching model. For faculty development program, am I audible? Do you have any disturbance?
Yes, ma'am. Yes, ma'am. We are able
Am
to
I
hear.
audible, madam?
Yes, ma'am.
Okay, madam. Thank you. From classroom to clinic, a teaching model, faculty development program, the most useful approach is to move from awareness to practice. The nursing telehealth is a staggered way so that students learn concept, observe demonstration, practice in simulation, and in a supervised setting. So first one is introduce concepts. So what concept do we have to be introduced, and how far we have to be follow this digital health services and the telehealth that we have to be learned in the form of concepts, then demonstrate consultation. So how we have to be provide this virtual care. Next, simulate interactions. So they have to be practiced as a simulate with the help of the simulator. Next, supervised clinical use. The faculty should supervise the students how they can be disseminate the information to the care where they are the virtually they can able to receive the care from the care providers. So these all are as a teaching faculty we have to teach the students how they have to be disseminate the information. This progression help faculty avoid teaching. So the core skill, yes, please, thank you. Avoid treating telehealth as a separate topic. Instead, it becomes a part of communication, community health, medical surgical follow-up, maternal child health nursing, psychiatric nursing, and chronic care education. The goal is not merely technology use, but clinical decision making in digital environment is important. So not only the education, the implementation of the care in all the respective disciplines where there is a psychiatry, community, medical and surgical nursing, and gynec and obstetrics. Each and every area we have to be get the knowledge and get the communication to incorporate the care virtually by the telehealth model. Core skill students must learn. The telehealth competency combines technical influence with nursing judgment. A well-prepared student should have knowledge confidently, communicate effectively, access safety, and maintain therapeutic relationship in a virtual format. Faculty can strategize these ability using role play, simulation, reflective debriefing, and assessment rubrics. So they have to be the students can be prepared how they can be implement the care virtually, how they can implement the care through the telehealth. So by the role play they have to be prepared. Prepare the encounter, check identity, location, consent, device readiness, and the language preference before the consultation is begins. So by the implementation of the telehealth services, the students or the learners, the faculty should be get ready with the technology and the system should be ready, the person should be ready, we have to get the consent, we have to know the location, so we have to be ready to provide the care. The next one is assess with the limits in mind. So use structured questionnaire, observe visible signs, ask about danger symptoms, and know what cannot be safely assessed virtually. So by the assessing the client, they have to be the important questionnaire. While asking the questionnaire, while in the conversation, we have to observe the visible signs, what the signs we are expecting from the client, or what the signs is exposed by the client. We have to observe as a care provider that we have to teach the students, the learners also must follow, and also ask about the danger symptoms. If just for example, if you are unable to see by the physically, we have to ask the questions when there is a hematuria is presenting, or when there is if the person was unbearable abdominal pain, they may complain. So when we can ask if there is any blood present in the stools, or if there is hemoptysis, hemoptysis, we have to assess the internal hemorrhage. We have to ask the symptoms. Do you have any of these type of symptoms? Or any glinted vomiting? Or any pale colored stools? So like that, based upon the patient condition, we can ask the client how the patient is feeling. So to identify the danger symptoms, then only we can suggest the persons in the right manner and build a rapport online. We have to speak very clearly, maintain eye-to-eye contact with the camera, and summarize often and confirm understanding throughout the visit. So, by the end of a session, by the in the virtual or by the telehealth, we have to ask the persons, "Am I understand?" With their understandable language only, they have to be communicate. If they are okay, then only we can conclude the session. Close safely. So that much of rapport we have to be maintained with the client. The close safely provide instructions, warning signs of timing, and documentation that support continuity and accountability is important. The documentation is very, very essential for review of the person client and also for the legal purpose, for the patient review. The reporting documentation is very, very essential. Ethics, privacy, and the professional boundaries. See, each and every area, whereas in a medical health, wherever you are doing a care, we have to follow the ethics and we have to follow the privacy, and also we have to know the professional boundaries to protect the client, to protect ourselves, to protect the profession. These all are we have to keep in our mind. We have to provide the care. The telehealth introduced new responsibilities around confidentiality, informed consent, identity verification, data security, and digital professionalism. In teaching, faculty should emphasize that the same standards of nursing ethics apply online and offline. But the risks and safeguards are different. So the privacy is the first. Use secure platforms of private space and careful screen practice to protect patient information. When we are discussing with the patient, we have to maintain the privacy. What discussion is going on with the client, it should not be leaked to the others. Just for example, we are discussing or we are doing counseling with any HIV patient. That information we should maintain confidentiality. When we are doing any genetic counseling, so that matter also should be confidence. As like that, based upon the situation, we should not reveal the information. And we are in the call, that room should be maintained for privacy. So next one is the consent matters. Patients should understand the nature, limits, and alternatives of virtual care before encounter begins. So the consent is very, very important to protect ourselves. And know the scope. Nurses and students must work within the instruction policy, legal requirements, and the professional boundaries. Whenever you are providing the care, you are providing the advices based upon the theoretically, it should be legally, it should be empathetically. We have to provide the advices or the care based upon the institutional policy. So which information only we can give, that only we have to give. We should not cross our professional boundaries. We should not be enter into their personal matters. We have to be think about the professional as a professionals, and we have to give care as a theoretically or clinically what they are required. The next one is a document clearly. We have to record advice, assessment, limitations, referral, and follow-up instructions in a traceable way.
I request other participants to be please mute yourself because it's interrupting the session.
Thank you, ma'am.
Continue. ma'am.
Next, lastly, be culturally safe. The consider language, digital literacy, family involvement, and access barrier when planning care. So when there is a requirement of the family members' involvement is more important when imparting the care. So that is, and also their understandable language only we have to teach the care. Otherwise, they are unable to understand. And also based upon their, if they are unable to, they are illiterates. We have to be explain them in the diagrammatic form. If they are literates, we can explain them in their understandable language. Where there is a requirement, we have to involve the family. Where there is a not requirement, we should not involve the family. We have to maintain that privacy. So these all are very, very important to maintain this ethics and the privacy. Faculty development should also address common risks such as misinformation, poor connectivity, incomplete assessment, device sharing, and inappropriate use of personal message channels for clinical care. So these all are we should not be do. We should maintain the confidentiality and privacy and all. And how nursing faculty can integrate telehealth into current issues. The most effective implementation in international and incremental faculty do not need to redesign every course at once. Instead, they can begin by inserting telehealth examples into existing subjects and gradually developing simulation, assessment, and clinical linkage. First one is a map where telehealth fits. Identify course and topics where virtual care naturally supports learning such as community health, chronic illness, mental health, maternal care, and discharge planning. In which area we have to plan the virtual care. Based upon the need, we have to plan. Where there is a fit of the telehealth, then only we can be implemented. The next one is a create simulation scenario. Use role play and case-based practice and evidence-based practice to teach virtual assessment, communication, escalation, consent, and documentation. Next, assess competence. Develop rubrics for digital professionalism, clinical judgment, communication quality, and safe decision making in online encounters. So they say we should not be take risks during the virtual mode or in the telehealth or in the online field. Lastly, build partnership. The collaborate with hospitals, community agencies, and telehealth service providers so students can observe real workflow and understand implementation challenges. So these all are very, very essential. While the nursing faculty, they can be integrated with the telehealth. They have to learn and they can be teach the students to implement of that program. Key takeaways for nursing faculty. The telehealth is not a temporary add-on. It is becoming an essential mode of care delivery in India for nursing education. The opportunity is to prepare graduates who can communicate well, think clinically, protect privacy, and support equitable access to care in hybrid models. So this is a very great opportunity for the nursing faculty. We have to be prepared the students. They can be able to provide this telehealth and virtual mode teaching, which will be easy access and essential access who are the needy people for their continuation of their care, for the rehabilitative services, and for their counseling. So through that, we can be provide more care to the people where there is a requirement, and we can also save the people from the complications. First one is access. The virtual care expands reach to patients who are geographically or physically separated from the services. They may be very far, wherever they are, we can provide the care, that access we can have by this telehealth. That we have to be teach the students. Next, capability. The nurses can lead education, follow-up, triage, and coordination in digital environment. Even in the digital environment also, the nurses can provide the care and the nurses can protect the patient where there is a need or where there is an emergency. And where is in the curriculum? The faculty should embed telehealth into teaching, simulation, assessment, and clinical practice. We have to teach the students how they can be utilized by the in the form of assessment when they can be applied in the clinical practice, how they can utilize these digital health services. We have to teach to the students. The confidence. The students learn best when they practice safe, ethical, and patient-centered virtual care repeatedly. When they were as a students in front of us, we have to be make them to prepare with the help of the role plays. They have to implement in front of the teaching faculty. They can have the develop their confidentiality. They can provide the care by the through the telehealth. The future of nursing in India will be increasingly hybrid, part bedside, part community, part digital. Faculty who prepare students for this reality will help shape workforce. This is adaptable, equitable, and ready for the next era of care. This is surely we have to be implement this digital health era. before COVID, so we will be very rare in the Zoom platform and utilization of the digital health services. So after the COVID, each and every discipline, we are utilizing the healthcare services by the online or by the telehealth or by the virtually. Not only the healthcare, whereas in the classes where there is a dissemination of the information, the digital services which will be more utilized in the present scenario. So now as a teaching faculty, we have to prepare the students well to utilize the digital health services to implement this telehealth as virtual learning. Thank you, Vananda. Thank you, madam. Thank you for giving up this opportunity, which is a very important topic in the present situation. Thank you, Vananda. Thank you, Vanaja, madam, and thank you, the college, Narayana College of Nursing, and the dear nursing faculty for the patients listening. And Pratima, thank you, Vananda.
Thank you, ma'am, for your valuable sharing with us. That was really understood by us, ma'am. So what is the role of digital health and virtual care? So as you given an explanation that the pre-COVID, how we were utilizing the digital and how COVID-19, how that was a big example where we can understand. And I think, ma'am, you could also initiated the digital health course and how we could register that. Can you just give us, ma'am, one word about, ma'am?
Ma? Pratima, please tell me.
Digital health course, which is being initiated by TNA, ma'am. So it is
Yes.
TNA is
Yes,
motivating everyone. So if you just give us one brief about the digital course, so let whoever
surely, Amma.
register, yes.
Surely, we will plan. We are planning. So where there is a, we will incorporate with the TNA. Vanaja madam is already is there with the college. So
Yes.
definitely we are discussing with the national leaders. So incorporate. We will manage. We will maintain many more programs through this virtual mode. So definitely we will plan, Pratima. So
Actually,
this is
one of
more
the
important. It is
course is
very
that
accessible for yes, ma'am. Please.
already one course module is developed by TNA, ma'am. So they are giving
Yes.
encouragement that if we early do the complete the course, we can get some prizes, cash awards.
Yes.
If you inform them, let everyone do the digital course, ma'am.
Yes. Please come in. So many programs in the future. Also, they are planning many programs in the virtual mode. Only thing we have to motivate our nursing faculty and the students. So we will create that awareness. Our team is working very well. So definitely in future, within a very few months, we will very reachable to the each and every faculty, to our each and every professionals by this mode.
Yes, ma'am. Thank you so much, ma'am. In spite of your busy
Thank you.
schedule, you have come over the hybrid platform to share your views, ma'am. So thank you once again. I know.
Thank you, Amma. Thank you so much.
Again, congratulations to become as the president of TNA AP, ma'am. So we are proud of you, ma'am. So thank you. Thank you so much, ma'am, for joining with us.
Thank you, Amma. Thank you.
So if they have any
Thank you, Amma.
Yes.
Pradima, I am Vijayalakshmi from Savita College of Nursing.
Yes, ma'am. Good evening, ma'am. The session of will be taken up by you tomorrow, ma'am.
Tomorrow,
so thank you for joining with us, ma'am.
Ma'am, nice to hear from your side.
Yeah, ma'am.
Tamil Nadu Nursing Council is having a telehealth nursing.
Yes, ma'am.
Stating that about credit points. Like that, if you have your Andhra Pradesh is having anything like that, I have no idea.
Sure, ma'am. Ma'am, Vijayalakshmi ma'am is a principal of Savita College from Chennai, ma'am.
Yes.
Right. So madam would be taking up the tomorrow session, ma'am. But
Ma'am, good evening, ma'am.
Okay.
Nice to
Yeah,
hear
good
from
evening,
you,
madam.
ma'am.
Really.
Good evening, madam. Thank you, madam. Thank you.
Great opportunity to meet you, ma'am, in virtually.
Thank you, madam. Thank you, madam. Pratima, Vanaja, madam, we will plan in the future presentations. Before that only, we will apply a letter for the credit hours, madam.
Sure.
From the APNMCR, from the TNA, from the INC also. Priorly, we can apply the letter. We are conducting the presentation or sessions in the hybrid mode. Please allot the credit hours, which will be very helpful for our professionals. So definitely in the future presentations, we will plan for the credit hours.
Yes, ma'am. We'll approach you, ma'am.
Okay.
Sure, madam.
Thank you,
Sure. Thank you.
Thank you, ma'am. So Vijayalakshmi ma'am, thank you so much, ma'am. I didn't notice that you were here.
It's okay. I want to attend that, so that I attended from the 4 o'clock onwards.
Sure, madam. We will do in for
Thank you.
future presentations.
So we'll
Yes,
be
ma'am.
waiting for your session tomorrow, ma'am. So
Sure. I'm ready for that.
thank you, ma'am, for joining with us. Very short period made us to be understand the telehealth, ma'am.
Thank you, Doc.
Yeah, I think someone would like to ask a question. Any queries from the participants, or shall we end up the program? Because I think was well explanation, ma'am. So thank you, ma'am. So let us end
Thank
up.
you, ma'am.
On behalf of Narayana College of Nursing, I express my heartfelt gratitude to Usha ma'am and Vijayalakshmi ma'am,
Thank you, ma'am.
sessions and other all
Thank you.
participants. Ma'am. So thank you, ma'am.
Thank you, ma'am. Thank you so much.
Yes, ma'am. We are going to leave, ma'am.
Thank you all for the patient listening.
I request the
And thank you,
participants
one and
to
all.
join tomorrow for, as usual, the 4 o'clock sessions. And before that, we have shared the pre-test link. Kindly fill that pre-test link. And even the post-test link will be shared on the 3rd day. So this all for your valuable. We would like to.
Pratima,
Yes,
Pratima, thank you. I am leaving the session.
yeah, ma'am. Thank you, ma'am.
Thank you, ma'am. Thank you. Thank
Thanks to all the participants to fill the pre-test form. Thank you all.
ఫోన్